Good morning, I'm Mykola Paranyak, trainee in esophageal gastric surgery, Odessa National Medical University, Ukraine. I would like to present our study, Conservative versus Surgical Treatment of Gastroesophageal Reflux-Related Cough. Typical esophageal symptoms of GERD are heartburn and regurgitation, although 10–30% of the patients reported cough, which is one of the most common extraesophageal symptoms. According to scientific reports, 25% or more of chronic cough cases are associated with GERD. Treatment of typical manifestations of GERD is well researched. At the same time, the effectiveness of surgical treatment and conservative therapy of patients with extraesophageal manifestations of GERD is not so clear. The aim of our study was to compare the effectiveness of conservative and surgical treatment of patients with cough as an extraesophageal manifestation of GERD. From September 2015 to October 2016 in Odessa Regional Hospital, we conducted a prospective study. 66 patients from 42 to 68 years old with heartburn, acid regurgitation, and chronic cough were enrolled and divided into two groups. First group included 41 patients who underwent laparoscopic Nissen fundoplication, and second group, 25 patients who received proton pump inhibitors therapy. The results of the treatment were assessed using 10-point visual analog scale for frequency and intensity of cough, 24-hour impedance patch monitoring, and GERD quality of life questionnaire. Follow-up was completed with a mean duration of 26 months. Our results: frequency of cough was similar between groups before treatment, and as we can see, it decreased after surgery and after conservative therapy. It's worth to emphasize that in the second group, the symptoms gradually worsened after 6 months of treatment. The intensity of cough decreased to a greater extent in the group of patients who underwent surgery. Also, the symptoms of cough were significantly lower in the first group at 6, 12, and 24 months. Mean Demister score and mean symptom index score were significantly better in group of patients who underwent Nissen fundoplication. Conclusion of this study is that laparoscopic Nissen fundoplication comparing to PPI therapy have more significant impact on improvement of respiratory manifestations of GERD. Thank you for your attention.